Modern teaching tactics. What are these tactics? Prepare the learners to achieve the highest score on the test. How do you do that? You prepare them, help them to manage their time, and make a schedule for them. When you prepare them, you got to advise them to study past exams. They got to know the test format. They got to know their strength and their weakness. You got to show them the key concepts, and they got to study in regular basis. When you manage your time, ask yourself a question. How much time do I need? When do I start? Do I need a structured plan? Multiple questions exams require a long term devoted to studying. It focuses on details. It is not a short term thing. You can't retain many details effectively in a short term memory. You learn a little bit every day and allow plenty of time for repeated reviews that will build very reliable long term memory. Then make a schedule. Stay with the schedule. Try to finish ahead of the schedule. The second thing, you build stamina. You got to build stamina. Use the salami technique. A thin slice every day so you can digest it and enjoy it. Study something every day. Need to have dedication, commitment, and discipline. Study on a regular basis. Know your strength and your weakness. Need to work on your weakness so you can get to the mean in all topics. If you reach the mean in all topics, you probably will get a very good score. Study on a regular basis. Use multiple sources. Time yourself. Practice speed and strive to cut the time in half. And do more. Do a lot more every day. Practice under adverse, stressful conditions. Simulate the worst possible condition that you could face on the day of the exam. Build confidence and mental stamina. Recreate the test environment as closely as possible. Predict, anticipate, and then select. When you see it, you kill it. Be confident. Tell yourself, I've seen this before, and I know which key will open that door. Another tactic is the Costco style, the wholesale and bulk education. You get more for little. In my opinion, the best way for teaching is to teach concepts. Find the concepts and find something in common between these concepts and link them together. For example, the word hypothyroidism can cause slipped capital femoral epiphysis in children, but it can also cause frozen shoulder in adults, like diabetes. Diabetes also can create Charcot foot, which you need to differentiate that from osteomyelitis of the foot. The shoulder joint can also be affected by Charcot, but it's not from diabetes, it's from syringomyelia, a spinal cord problem. Diabetes can also affect the infants and create sacral agenesis if the mother had maternal diabetes. Diabetes can also affect the spine, creating DISH. You need to get hemoglobin A1C for the patients. And DISH is different than ankylosing spondylitis, where you need to get HLA-B27. You need to connect the dots. This is another tactic. So what is these dots? You got things similar to each other. You got things that overlap in their symptoms. For example, the sacroiliac joint, the spine, and the hip. Is it sciatica or is it a hip pain? Sometimes these patients see multiple physicians and they had multiple imaging studies and various procedures without relief. If you find the patient has one problem, make sure that the patient does not have the other problem. Don't focus on one problem. You must correlate the clinical examination with the X-ray findings and the MRI findings if the patient has a hip or a spine problem. If the patient had a hip problem, ask the patient to point at the area of the hip pain because there are a lot of things can create hip pain, not just arthritis. Another tactic is to use the community YouTube section. Here's an example of the community section of YouTube. You can ask the participant any question you want. It can be a quiz written or a quiz in the form of a picture. You can post a picture, you can post a video, you can interact with the participant all over the world. This is your private channel. You can put all the education you want in your channel. This is a picture quiz. The nerve involved in heel pain is a branch of, it's supposed to be the lateral plantar nerve.